Hello everybody, my name is Adudeng, a student of Maradi University in my third year of physiotherapy. I am doing my rubrics 2 of surgery, and in my rubrics 2 topic for surgery today is types and grades of prolapse. So basically, prolapse is a condition in which organs fall, slip out of place. So this prolapse basically it's just all about the pelvic organ and stuff. So let us go into deep details and I show you some PPTs so you can see them. As I told you before, prolapse is a condition in which organs fall down or slip out of the place. It is used for organs producing through the vagina, rectum, or the maglinate of vessels of the heart. So in types of prolapse, we have the pelvic organ prolapse, which occurs in one or more pelvic organ drop from their positions, causing a plague in the vagina. In the symptoms of this type of prolapse, we have seeing or feeling plague of tissue at or beyond the opening of the vagina. We have pelvic pressure or heaviness or pain. We have lower back pain. We have not being able to keep in term top. We have urinary changes, sexual issues, and bowel changes. To not waste time, let's go to the further. The second type of prolapse, we have the vaginal prolapse, which occurs on top of the vagina, weakens and folds into the vaginal canal. Let's talk more about the symptoms of this vaginal prolapse. We have feeling of fullness, heaviness, or pain in the pelvic area. You see, in this kind of feeling, often gets worse as the days goes after standing, lifting, coughing, or doing some heavy work. In the vaginal prolapse, we have the lower back pain, plaque in vagina, feeling like something is slipping out of your vagina. We have leaking pee, basically, which is the urine incontinence, repeated bladder infection, difficulty in pooping or defecating, problems in sexual intercourse with your partner, problems in inserting tampons. The third type of prolapse is the umbilical cord prolapse. Is when the umbilical cord comes out of the uterus or before the presenting part of the baby. The signs and symptoms of this type of prolapse is the first sign is umbilical cord is usually sudden and severe, decrease in the fetal reduction rate that does not immediately resolve. On fetal heart reacting aligner recording of the fetal heart rate. This would usually look like moderate to severe variable decelerations in overt cord prolapse. The second sign and symptom of this type is once the cord is prolapsed, it is prone to compress by the fetus and the womb. This can cause decrease in oxygen supply to the fetus, which can be fatal. A majority of umbilical cord cases happens during second stage of labor or second trimester. So let's go more and talk about the grades of prolapse. We have 4 grades here. We have the grade 1, grade 2, grade 3, and grade 4. In grade 1, it is mild, which only occurs in small portion of bladder drops into the vagina. In grade 2 is moderate, more kind of middle. The bladder drops enough to be able to reach the opening of the vagina. In grade 3, it is severe. It is severe or chronic. This associates with more severe symptoms and noticeable plaque in the vagina. In grade 4, it is complete proposal, so which is basically chronic. The most severe kind is where the organ has shifted out of place. Thanks a lot for watching. All we had for today. Thank you so much for watching. I hope you have learned something that will help you in the types or in the grades. See you again. Bye bye.